Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a guest with us once again this week, Hope Ouelette. She is the Manager of Education and Infection Prevention at Masonicare Health Center. Welcome, Hope, and thanks for joining us.
Hi, everybody.
Well, it's such a pleasure to have you. Back in December, when we began vaccinations of our residents and team members, you were asked to be the first Masonicare employee to receive the COVID-19 vaccine. We'd love for you to reflect back upon the significance of that moment, both personally and professionally.
Well, personally, it was an honor. I went home that night and I told my children and I called my parents and because those are the most important people to me. And they were like, "Wow, Mom, that's like great. That means you're standing up. Your name really means something, Mom." And for a long time, my son always says to me, "Mom, do you know why your mom named you Hope?" I'm like, "I don't know." And he's like, "I think she named you for a reason because you are very hopeful." I always am. I try to look for the good in things. So I was very honored to be able to do that. It also meant that people would look up here at Masonicare, see that somebody's doing it, and I wasn't afraid to do it because I wanted them to know that it's going to be okay. If you do this, things are going to change. Things are going to get better. The residents are going to be able to have their visits. They're going to be able to start to be a little bit normal again. Families coming in. So this was that one step to start us in that direction, where we are right now. We're back to family visits, which is huge. The hairdresser just opened, huge for these residents. It's amazing. Just getting your hair done. I know personally when we were on lockdown, it was huge for me. So these guys, you can see the change in people, how they are on the floor. The residents are on the floor. They got that little bit of glimmer in their smiles and twinkles in their eyes and stuff because they know that now things are happening. So for me, it's very important, and it showed my family that it was okay to get it. And people would ask me, "How are you feeling? How's everything?" And I'm like, "I'm good." It's a little bit of a headache, but other than that, I was fine. So I think it was for me, all in all, it was a very touching experience for me as a nurse.
That's wonderful, and it's so great to hear about how the residents are doing now. Thank you for filling us in on that too. And JP, Hope and her namesake, they symbolize how we all feel about the future after weathering this pandemic together.
Well, hope prevails. It is our term that we use quite a bit now. Hope prevails because ultimately that day, December 21st, really was the start of hope. It was a start of us getting back to some normalcy. Hearing Hope talk about the hairdressers coming back, visitation coming back, that was the ultimate goal. December 21st was to really get ourselves back to normalcy. And it's interesting because I've been asked by a few individuals, and even recently yesterday, a family member saying to me how she was so proud of Masonicare taking that step forward in starting the vaccinations early and essentially mandating all of our employees to be vaccinated by June 30th. It was something that a family member said to me yesterday that tells her that we are putting the residents' safety first and foremost in everything that we do. And it was very reassuring to hear a family member telling me that yesterday. And I see us continue to move forward with the hope. Hope prevails. Hope is that shining star in really getting ourselves to being able to do even more. Recently, we were talking about, are we going to have our Grand Masters Day? And we unfortunately won't be having it in June, but we pushed it back to September. Why did we do that? Because we do feel at some point we're getting close to being able to do a little bit more and get ourselves again back to that normalcy. And Hope, I just wanted to thank you for that day, because that day under that tent in the very cold weather, rolling up our sleeves, getting the shot, and being an example, a leader to show everybody that this was safe and that this really was the liquid gold of hope that would get us to where we are today. We're not out of the woods. We've still got a lot to do. Wear your mask, continue to social distance, not being in large groups is still our thought process, and we will continue to do that. But if we continue to do all of this, this will allow us to get to that normalcy, allow us to really push forward as a company, as a state, and as a nation. We will get through this.
Yeah, there has been like so many changes since, yesterday was my 1-year anniversary here with Masonicare. So I started right before all the craziness really hit here. And now, I've had some time to reflect, and we have done so many things, and with proper PPE and education to the staff, education to the residents, because some of the residents, you have to remember, they're not used to wearing masks, and they have to know, and you have to explain these things to them, to their families. We basically are their families when they're here. Their families couldn't be here, so we had to be those people. The FaceTime visits are huge, families can voice their concerns, of whatever they need to. Now we have the eye doctor coming back in, all these things are coming back, so I can see it coming full circle now to getting back to that, like you said, normalcy. And everybody still has to continue, because we know if we lax a little bit too soon, things can happen. So everybody has still been doing it. Everybody's been vigilant. We've been consistent. So I think we're headed in the right direction, where September we will be able to do this, and it'll be a great thing. I look forward to it because I've never experienced it. So I'm really kind of excited for some of these things,
Well, thank you. You've done an amazing job, you and the leadership there, really pushing forward. And it's one thing to fight the virus. It's another thing to try to still get that gleam in everybody's eyes of happiness. And mm-hmm. I think we're continuing to move forward to get that gleam really back to some normalcy.
Yep, I do too. Mm-hmm.
It's just wonderful. Thank you both so much. And, Dr. Schwartz, echoing what JP and Hope have been saying, as vaccinations continue around the world, we certainly have much to be hopeful for. But we just can't stress enough how critical it is for all of us to continue to make those very careful decisions when it comes to our social activities.
It's true. I mean, people don't realize that even though things have lightened up, there's still things that I won't go and do, only because I don't put myself in those situations because of my job. And, so I try to, trying to get out there a little bit more and to be out a little bit more, but I'm still very cautious because you just don't know. And I don't, you still have to be cautious.
Well, I totally agree. And, I just wanted to say to Hope first that, I do want to congratulate you for being the first to get the vaccine from Masonicare. It was a big step. And, when you think back to the last time that we talked or I saw you, it was in that cold tent, December 21st, and the vaccines had just been coming out, not vaccine, just the Pfizer vaccine, was the only vaccine. We were still learning as we went. So I think it took a lot of courage to, as they say in the cliche or whatever, step up to the plate and move forward with everything. But, the vaccine was really like a Christmas miracle if you think back to it. It was like, I didn't even realize the epic size of what was happening, but it was, there were many news reporters there. I wasn't even emotionally prepared for just what I was experiencing, but we were really making history, And when you think about it, it seems so long ago, so different, and yet it was only 3.5 months ago. So what we're really talking about is, how much progress we've made in just a in just a really short time. But like anything that we've talked about on these programs over the past with COVID, it's never over, really. And the next phase of this is, this new UK variant that seems to be, even more dominant now than other variants in the United States. And this particular strain is particularly hard on younger people, young adults that haven't been vaccinated, and children, and they seem to be the groups that kind of continue to propagate the virus. So, we've talked in the past about mutations and how the COVID-19 virus is actually an RNA virus like the flu, and the flu mutates, and the COVID-19 virus will continue to mutate as well. And basically the target of the mutation is the spike protein, as we talked about. So it's just something we have to expect and be aware of. What I thought I'd do is give you some quotes over the past week, because there's been a lot of reports from the CDC about this UK variant. And again, if you like abbreviations, it's B117. But these are some quotes just to kind of summarize what they're saying and what they're thinking about. So I think the key point, they say, there is a little difference in the way the B117 spike protein holds that makes it stick to your cells more easily. So these new variants, particularly the UK variant, seem to be stickier. That's the real point we're trying to use, stickier. And because the B117 is stickier, you may indeed have a higher viral load. If you have a higher number of viral particles in your respiratory tract, then it's going to be easier to spread it to other people. This is another reason why it's so important for young adults to get vaccinated. So I think those are some excellent points. I couldn't say it any better. So now you have the facts from the CDC, but it really emphasizes why we do these shows weekly and why we try to have the messages that we say, which is to continue to be vigilant. It doesn't mean you can't enjoy yourself and that things aren't getting much better, and they really are, as we talked about, just from the 3 months since we first got the vaccine to how many people are vaccinated and where we've come. But we still have a ways to go. We still have to be careful. We still have to wear our masks and hand wash and social distance and avoid large crowds and avoid travel. And most importantly, and this is something we emphasize every week, get vaccinated. So Hope, now I'll talk to you. Every week, if you watch these shows, I give an inspirational quote that kind of helps people through the week. It certainly helps me through the week. And sometimes my friends or colleagues give me a quote, because this is like our 21st show. And after a while, I start to need a little help with inspiration myself. But this quote was given to me by Ann Olson, who, if you don't know who she is, she's the executive director of Masonic Home Health and Hospice. And the quote was actually written by Helen Keller. And you'll see a little something in this that you might relate to. So it says, optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. So here I've incorporated your name into the inspirational quote for the week, and I think you've given hope to all of us by being the first to set an example to get the vaccine. So I thank you for your courage. And I want to thank everyone for their strength and their dedication and hard work, and just, again, wish everybody health and peace. Thank you.
Thank you.
Thank you, Dr. Schwartz. What a perfect way to wrap up our weekly discussion. We want to thank all of you for sharing your time and all of your insights with us, as always. And we thank you for joining us at home once again this week. Until we see you next time, we hope you'll stay safe and stay well.
Bye.